Hi, and welcome to this week's video podcast. I'm Brent Dodge, owner of Alpine Physical Therapy. I have with me today Brace Hayden, who has a doctorate in physical therapy from Slippery Rock University in Slippery Rock, Pennsylvania. Brace has an interest in treating face and jaw pain. I thought it would be really helpful to get his insights on how this process works and how people can benefit from this form of treatment in physical therapy. Brace, we're glad you're here.
Thanks, Brent.
Brace, you've got a background in physical therapy, you've got a doctorate in physical therapy. What sets a physical therapist apart who may have an interest in treating face and jaw pain, and what's your background in that respect?
So I have been working for about 10 years in this field and treating orthopedic type issues, and through the years I've taken some advanced training in treating orofacial pain or jaw or temporomandibular type joint dysfunction. And I have a advanced specialization or board certification in orthopedics, and this is a specific interest that I do enjoy treating, and it's usually related to neck or headache pain, and also some referred pain coming from the jaw joint here or the temporomandibular joint that can create referred pain into the face or the muscles of chewing.
So for our viewers, someone out there that's got maybe some jaw pain or some face pain, how would they know that physical therapy might be a helpful avenue for them?
Well, typically we look at, a lot of people, there is a high prevalency of neck and jaw-related pains in the adult populations, and some of them aren't getting better on their own after a couple weeks. So typically the signs and symptoms to look out for are joint noise, clicking, popping, pain with chewing, or side of the face pain in these muscles along your temple here or in your jaw, pain in the ear. There's any number of things that can be referring pain into the face, but specifically we look at it from a mechanical standpoint. Is this coming from muscles, or is it coming from a joint, or possibly being referred from the neck?
So some of the signs and symptoms, obviously, face pain, pain along the side of the jaw or the side of the head. Are there other signs or symptoms that might lead a person to say, this sounds like I need to go see my physical therapist to get some help?
Yeah, typically problems that obviously are not getting better on their own, we usually get referrals in from primary care providers, physicians, or dentists, or people come in directly if the insurance provides it to see a physical therapist for this. We will do a thorough evaluation on kind of dividing where is this problem coming from, what's generating this pain. We break it down into, is it a muscle issue? Is it a joint issue with the temporomandibular joint that's causing the dysfunction or the jaw pain? Or is it a combination of both? Or could it possibly be referred from more neck type issues into that region?
So somebody coming in, they've got, let's say, some jaw or face pain, and they're going to see you. They could end up actually getting treated for more of a neck condition if that's the culprit, as it were.
Absolutely. There's a prevalence of about 70% of people who do have neck pain also experience some temporomandibular joint issues or jaw issues, as there's a lot of crossover. So we'll often be treating both the neck and the temporomandibular region to reduce pain and stiffness in this area.
I guess one of the things that a physical therapist might need to do is determine, A, is this a neck problem, or B, is this specifically a problem within the joint itself, the jaw joint or the temporomandibular joint? How do you go about defining that?
So we do conduct an evaluation, and first we need to rule out that this isn't another major red flag issue like a tumor or a major neurological thing going on. And from this, we run through kind of a battery of tests, trying to divide out, is it a muscle problem? And typically with muscle related pains, there is pain with chewing, and there in possible throbbing pains in here or difficulty opening the mouth. So we look at kind of mechanically, is it coming from the muscles, or is it more of an inflammation issue or a disc displacement issue in the joint, or possibly having a hypermobile jaw, or the opposite end of that, having a mouth that doesn't open well from some kind of fibrous adhesions that might be holding that shut or reducing the jaw mobility, thus making it difficult for the person to yawn or open their mouth to chew, or having pain while sleeping on the side of their face.
Well, if you did have a jaw problem, let's say it was the pad inside, the disc within the joint, do you have a set of treatments that you use to address that?
Sure. So typically, treating more of the temporomandibular joint dysfunction, we look at a few things, and first off is just looking at kind of orofacial habits. Are they doing particular things during the day that might be stressing this joint, whether it's clenching their jaw or biting their fingernails, or is it some dietary type things that are really stressing it, or are they just resting on their chin all day at work, or kind of creating a lot of facial muscle activity that might be irritating this? And from that, we educate them a lot on kind of awareness of things that could be bothering it and work on some problem solving. From that, we also look at, if this is an inflammatory jaw condition, we will use some modalities to reduce joint inflammation in the jaw. We'll also work on some manual techniques to see if we can't work on getting it moving better, if it's a stiff or hypomobile type jaw, and also seeing if we can't work on the muscles around it to get them more relaxed or out of a spasm, and get some gentle stretching for them to get a more functional moving mouth or jaw.
Yeah, so we have very specific jaw conditions. It sounds like you have a good grasp on various treatment forms for that. What I find interesting, Brace, is that when I get people in for a variety of orthopedic conditions, a lot of them identify some tension or potentially even pain in the jaw. Have you seen that much?
Absolutely. The facial pain is a big issue that could be coming from a number of things. The unfortunate thing about the jaw joint is that it's really well innervated. It has 3 big different nerve groups that come into it. Each of those, if that nerve gets hot, it can refer pain into the muscles of chewing or mastication here. It can refer pain up into the temporal region or kind of behind the ear. So we do look at ways of seeing if we can reduce this pain through modalities or kind of changing some of the daily habits, working on some stretching techniques for these particular muscles, even getting inside the mouth or doing some work on the muscles on the outside too, selectively see if we can reduce pain by getting these muscles to settle down.
Do you see a connection between people who are experiencing various forms of face pain with more tension type or classic type headaches?
Absolutely. Headaches and facial pain go hand in hand. Often, through our evaluation, we look at what is causing this area of discomfort, and is it mechanically available? Is it something from kind of bound up muscles that are being held in a really restricted position that could be creating areas of tightness and thus referring pain into the face, or creating some type spasm areas in the back of the neck that could be creating a headache? And there's a lot of interrelationship between these pains and dysfunctions.
For our viewers, I think it would also be helpful for them to realize we've got a couple podcasts available on the health information link of our website. 2 documents or 2 topics that come to mind. One is pain reflex release technique, and I've had a pretty good amount of success with some aspects of jaw pain, particularly as it deals with those nerve centers that you had mentioned, Brace. And the other is a topic on spinal manipulation that may be of some value if you're having some head, face, neck, or jaw pain, to consider watching those videos as well. Well, I know our viewers are probably ready right now, Brace, for a tip of the day.
This is the tip of the day for treating oral facial pain and temporomandibular joint problems. A tip I like to give people just to practice some awareness of where their jaw is sitting during the day. There's a big relationship between the body posture and how this temporomandibular joint is seated. And so if you are having some discomfort in your jaw and it's not settling on its own, I'm going to put out there that trying to sit up taller and be aware of that jaw position and its kind of alignment as you're sitting throughout the day. To reduce stress on it, think about just keeping your tongue gently relaxed at the top of your mouth, gently breathing through your nose, and thinking about resting your jaw in a neutral position with your head up tall and relaxing your jaw muscles so that you can wiggle your jaw to reduce stress on it throughout the day.
Thanks for joining us in this week's topic on face and jaw pain. I'd like to thank Brace Hayden for joining us.
Thank you, Brent.
If you'd like more information, be sure to visit our website.